Hi everyone, welcome to my Facebook Live. I'm Dr. Sally Foote, a veterinarian and animal behaviorist, and I'm going to, today's Facebook Live presentation, I'm going to talk about curbside care. I'm going to just adjust the camera because now it was a little off from how I had it set up at first. So, oopsie, there goes my ring light. There you go. Okay, I think that's going to be a little bit more readable. Okay, well, thanks. Thank you, everyone, for joining me. These Facebook Lives I am uploading to my YouTube channel, so if you want to watch these again, and it's a little bit easier, to get to them than scrolling back through Facebook feeds, make sure you go to Dr. Sally J Foote at YouTube and subscribe. And then I'm also featuring them in my newsletters as well. Okay, so curbside care. Curbside care, oh my goodness, it has been almost a year of curbside care. I can't believe it. Anyway, so curbside care is the way that in veterinary practices, the client is coming into the practice, they make their appointment, however which way. They call the clinic, maybe they're using more automated emailing, appointmenting through the website, whatever. But the client pulls up to the practice and then needs to either text or call the practice to say, hi, I'm out here, and I'm out here in my car with my pet. And then the veterinary assistant technician staff will come out to the car and may take some history if we didn't do a lot of, pre-history taking on the phone, and then take the pet from the car, from the client, into the practice building, provide care, and return the pet. Okay, so that's why it's called curbside care. Because of the pandemic, and because our offices are small, and this is something, especially when I'm providing behavior consultations and collaborating with primary care veterinarians, when I'm saying, it may be a couple of days before your veterinarian can get back to you about the medication, or the pet does need to get in for an examination, where there may be a delay in scheduling, because in our practices, our typical examination rooms, before we put the furniture in, are only 8 feet wide by 10 feet long. Once you put a 2-foot counter, an exam table, and a seat for the client to sit in, I cannot get 6 feet away from my client. I cannot get 6 feet away from my assistant. So to protect our veterinary staff, that is why we have to be in curbside care, and we still have to be in curbside care right now, because while yes, yay, wonderful, we have a vaccine, and rates are starting to decline, COVID is still here. And if the veterinary staff gets sick, somebody is positive with COVID, many of the staff, even though we're masking, which is awesome and great, and many of the practices have installed the HEPA filtration air purifiers in the office, there is still a risk that internally that staff may get ill. And if they do, they're going to have to shut down for 2 weeks, which means no one will get care. So that is why, clients, please be patient. You're staying outside for right now. Okay. This is where we're at. But I wanted to talk today about how, has this been helpful? Has this been good, for some of our patients or animals, from the animal's point of view, or has it been bad, not so good? And honestly, we're seeing both. Now, the whole idea in fear-free, low-stress veterinary care is the client should stay with the pet because the pet is bonded to the client. Removing the pet and taking them in the back or in the treatment area would increase anxiety. And quite honestly, yes, it tends to increase anxiety for many of our patients. It may make our work really efficient, but in the pre-pandemic days, it would increase anxiety. Well, so why now? If we're taking the pet away, are some of them actually pretty calm or not upset? Okay, so that can be for a couple reasons, and I'm going to go through, both the good and the bad here. Okay, so curbside care, the client is staying out of the building. Sometimes in curbside care, maybe because if the pet was really difficult to get into the office, we're actually doing care outside, but curbside care. Okay, where it's good, how is curbside care helpful? It's actually a good thing helping the pet be more relaxed. I've had quite a few clinics and veterinary technicians saying, wow, this dog did way better. This cat was way less stressed. Coming in, taking them away from the owner, taking them from the car into the practice and providing care. Well, I think one of the number one reasons, it's called emotional contagion. Now we have emotional contagion from the human to the pet. What's that? That's the owner, the person with the pet who is worried, they're worried and they're tense. Maybe they're worried and they're tense about the drive over because the dog was panting or whatever. Or maybe they're worried and tense because, frankly, the majority of care that we do in veterinary medicine is sick pet care. Yes, we do vaccinations. Yes, we do preventative vet care. That is very true. Yet at the brunt, the biggest chunk, if you will, of our income and our work comes from the middle-aged pet. And so somebody's coming in now, they felt a lump on their dog, oh my goodness, I didn't feel these under his chin, and what's this on his chest? Oh my goodness, oh no. And they go to Google and they look it up, which they should do. This is the age of information on the internet. Anyway, lumps under the chin. Oh my God, it could be lymphoma. It could be blastomycosis. It could be histoplasmosis. And they're very scared. They're worried their pet has something seriously ill with them, and the pet can't tell them. And we're their only, way of trying to find out, right? So they're bringing their pet in, and the owner is tense, they're scared, and they're stressed. And boy, I tell you what, dogs especially pick up on the human body language, don't they? That dog is going to now be like, whoa, mom is fidgeting with her pocketbook. She's fiddling with her hair. Her voice sounds more tense. So the dog will be more tense because the human's tense. So now in curbside care, owner's worried because I'm feeling those lumps. Oh my gosh, what's happening? When we take the dog away from that owner and we have a technician and a veterinarian who's just kind of neutral. We're not acting tense or nervous. We might be acting even a little buoyant around this pet and giving them treats and doing less stressful handling to still make it good for them. That even though I may palpate and find lymphoma on this dog, which of course I'm going to feel not good about, I'm keeping my body language calm and good, so that helps this patient. So that emotional contagion is reduced in curbside care for our patients. Real important. Now the second place, emotional contagion also happens between animals, right? The dog who's whining in the back because he's anxious about being in a cage, maybe he's just woke up from surgery. And, in that waking up and recovery, sometimes you get a little bit of whining or you'll get a little bit of howling. We've all seen it. The otherwise happy dog in the waiting room exam room hears it. And now they're like, ooh, what's going on? And they get nervous because of what they're hearing from the other animal. Well, we've had to decrease how much surgery we're doing, hospitalization we're doing, because we've had to go to these shifts instead of full staffing. We don't have 5 veterinarians necessarily working every day, seeing lots of patients. Maybe we have 1 or 2 veterinarians. So we have a lot less kennel noise. Many of our practices have far fewer dogs whining in the back or cats whining in the back because we've had to change how many animals we're hospitalizing at a time or how many elective surgeries we're able to do right now. And this is decreasing then the animal-to-animal emotional contagion as well. Okay, so emotional contagion, reduction of this because we're separating the animal from the people and we're not having animals all around each other and so much in the hospital. That has been a good thing about curbside care. Okay, that'll bring me to this one, noise problems. Okay, just general noise. We tend to be noisy places in veterinary practices, and it isn't only because of dogs barking, cats meowing. Yet we have phones ringing. We have phones ringing. We do have barking animals. We have people talking. You may hear the dentistry machine running in the back for dental procedures, that high-pitched whining noise. People just literally walking because we have hard surfaces on our floor. We have to have very cleanable surfaces, and so most of our, everything is kind of hard surface to make it sanitizable and easy to keep clean, and that consequently leads to a lot of environmental noise. Well, now again, we're not doing as many surgeries. We don't have dogs, and people sitting in the waiting room waiting to be seen, so we have less barking in the waiting area or people in the waiting area. Yes, the phones are ringing off the hook. I mean, most practices that I've consulted with, collaborated with, they are literally seeing 4 times to 5 times the phone call volume. that they were seeing pre-pandemic days. So the phone is still an issue, okay? It's still noisy because of the phones. Yet with fewer staff members, we have fewer noise problems going on. So less noise in the clinic is less triggering for anxiety or fear, you know, in response from the animals. It helps it to be less stressful, just to be a quieter environment. All right, last one, waiting room problems. We don't have that anymore. How many of you had, you know, one dog is in the waiting room, the other dog walks in and it's like bark, 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 and they're after each other. I mean, even sometimes fights in the waiting room. We used to call it doggy traffic control at my practice, where when a dog was coming out of the exam room, the technician always checked the front waiting area, would ask somebody with another dog to stand in the other corner, and would literally like escort the person out. We did the checkout, you know, the payment, etc., in the exam room. But that was to avoid any potential dog-to-dog confrontation or barking, because sometimes we don't know that a dog is interdog aggressive until he shows up in a veterinary waiting room where now he sees another dog and they're very close together. You know, maybe this interdog aggressive dog has a fenced-in backyard, he doesn't get out for walks, he doesn't go to doggy daycare, he doesn't get boarded, there's just a kind of a quieter life. So sometimes the vet office is the only place where you would see these waiting room problems, especially dog-to-dog aggression. The second one is for our cats. When our cats would come in and have to sit and wait in the waiting room in their carrier, yes, we'd throw the towel over them with feel away, but still that cat feels very vulnerable sitting in that carrier as it hears the other dog barking or hears the telephone ringing. So now in curbside care, where we're picking up the carrier and going directly into an examination room to start the care, you know, and do the exam, you know, with a veterinarian without having to wait in the waiting room, that also helps our cats to tend to be more calm and less agitated, because we're just avoiding a lot of the noise and waiting room problems. Okay, so that's a lot of the good things about curbside care, and those are all really pretty valid. And you know what? I really feel that we need to keep this learning, what we've learned through this year, in our heads and apply this still as we come out of curbside, okay? So in other words, and this will be more Facebook Lives that I talk about, but how you tactfully will say to a client who you can tell is, oh my gosh, he's all swollen underneath there. What is it, doc? You know, you could tell they're very tense, and you hardly start the exam, and the dog is starting to pace and pant, etc. How you tactfully say, Mrs. Jones, I understand this is really worrisome for you, and to help Fido out here, if you could please just step outside the door for a few minutes, because I know you're worried and your worry is affecting him. That would help him the most right now. How to tactfully say that? I would say that to my clients, and they would. They'd step out the door. But how to say that? This needs to be in our tool belt, because emotional contagion is very real, and we shouldn't just sort of tolerate it, if you will, as, well, that's the client who always drives their pet crazy. No. This is something important for still providing that low-stress, fear-free exam and experience. And sometimes, you know, sometimes some clients, once you say to them, hey, you know, how you're acting, and you can't help it because you are worried, is hurting, it's like affecting or hurting your pet. Some clients calm right down because they want to stay there. Okay, fine. And then also the consciousness that we have about our noise levels in our practices. And lastly, waiting room management, how we manage that waiting room. Okay, so we're going to learn, and we're going to keep this learning ourselves as we go into the new world when we get there of less in the curbside care. All right, the bad, okay? Let me angle this so you can see that a little bit better, I think. And you'll see my closet. Okay, so, and I will stand over here. Okay, so the bad stuff, right? Yeah, and especially I was receiving a lot of emails and questions from veterinary staff about, oh my gosh, if we got to go into curbside care, it's flying in the face. It's going opposite of what we've learned from fear-free and low stress. Isn't this going to be horrible? And I said, well, no. We can still keep it low stress while we have to be curbside. And that's where I created my curbside care webinar. It's on my website, drsallyjfoote.com. You go into the shop. It's free because that's my contribution to help our lives be better through all this. But yes, there's still some difficulties, still frustrations with it, some things that, no, we can't make it all perfect. So one of the bad things, about it is client communication. This has still been a struggle. Even though most every person has a smartphone, and even though, say myself, standing in my office, I could pull out my smartphone, or if I wanted to have like a tablet, you know, an iPad or a tablet, you know, set up, and with FaceTime, where I can click and call directly to my client's iPhone, if they have an iPhone, or WhatsApp. That's the one that they can connect with to like a Samsung. Still, not all clients will do it. You know, you may say, I'm going to, you know, give me your cell phone number. Doc is going to call you directly from the exam room. The client may be really confused, like, huh, what? I haven't done this yet. And there is what's called app fatigue. People are kind of tired of the Zoom link. You know, some clinics have used Zoom and let's do this on the Zoom. You know, they're just kind of getting tired of it. And what they're really wanting, the client's really wanting, is to have me, like as a veterinarian, walk out and actually talk to them one-on-one, or the phone call. Now, again, this is where it's still risky. If I get sick, there's no vet. Okay, so if I'm like, no, I can't go out and talk to anybody because half my clients aren't wearing a mask in their car, and I don't know where they've been, and if I'm out, the whole place shuts down because I'm the only DVM. I may have to stick to my guns and say, I cannot come out and talk to you. And if I talk to you on the phone, because we're piled up with all these people, I can only talk to you for like 5 minutes. That's why I want you to use, you know, the video chat or whatever. But still, that's still been an issue. That's still something that hasn't dropped down. I think, again, we can learn ways of helping to make this communication a bit better. And I'm really a big one on embracing telehealth and telemedicine consults, that we can actually, you know, getting people to use those, but somehow elevating a lot of our clients to embrace and want to use, especially a simple video chat feature on a phone. That's what we need to do, but this is where it's been still a sticking point, is client communication. And I think the other part of client communication is us being transparent to our clients and saying that we only have a third of our staff working any of the day of the week, so that if Dr. Jones gets exposed from his child at home to COVID because child got it from some other kid, could have gotten it from any kid at school, right? That whole family has to go in isolation. We still have Dr. Smith, who's working on Tuesday, Wednesday, Thursday, while Dr. Jones, who worked on Monday, is now going to be off. We still have Dr. Smith because we don't have Dr. Jones and Smith working together. But because we had to split up the staff and go to the shift work and limit hours, that's why it's going to take 3 weeks to get an appointment in. That's why I can't call you back and spend a half an hour with you on the phone. Please understand it from my side. I have seen some really good Facebook posts where, you know, people are sharing this. I wish we had shared that from the start, to tell you the truth. A lot of clients are pretty upset about all this. But anyway, client communication. That's one of the bad things. Second thing, increased separation anxiety. And what I mean is in the moment of taking the animal away from the owner. When that dog is sitting down and balking and I don't want to leave the car, that's separation anxiety. Anxiety about being separated. And that's because we have a tightly bonded pet to the owner. And while that can be a very beautiful thing, now it creates a problem. So that's where it may be that in this 20-degree weather with a foot of snow like Chicago has right now, there may be some staff, veterinary staff, that are doing an exam and vaccinations out kneeling in the snow in the parking lot with their coats on and things, with the client standing 2 feet away, 6 feet away with their mask on, as a way of how we can get it done, because we can't get that dog away, literally easily away, you know, from the owner, because he won't walk and he won't go there. Cats, I've not heard that the cats are quite as affected by the separation anxiety from the owner, doing a lot of meowing or a lot of agitation. It's really a bigger problem with our dogs. Lastly, the bad thing about curbside care is has decreased our efficiency with being able to get clients in, being able to do the examination, being able to line up 4 clients in 4 exam rooms where the technician can go in and get the history and do the blood draw, and, you know, already had the vaccines drawn up and all this bing, bang, boom, and then I can go right in and I could quickly do the history, do my exam, give the vaccination, explain things, and then be right into the next appointment. And this is how, frankly, this is how many practices were able to keep up with like 20 to 25 examinations per veterinarian per day. But now with appointment anytime needing to go longer, plus I've got to go out to the car to get them, and then we're going to have to return them back to the car, it does decrease some efficiencies. And that's also where can't schedule as many people, besides the shortened staff, can't schedule as many clients in for examinations. So there's a delay in care for some of our patients. And then that decreased efficiency, it's primarily from what most of our care and what we're able to provide in practice, believe it or not, is primarily the outpatient work, which is our most profitable work. So while it's a decrease in efficiency, it's not hurting financially the practice, but it is making it's hard. There's a lot of veterinarians I've talked to who feel very frustrated about, like, it's really hard to fit in some of the really needed care. And so we're referring to the emergency clinics, and the emergency clinics are getting really bombarded with what is a lot of chronic problems. Yes, that should have been seen a year ago, and the client has not come in a year and a half, and you're going to put them ahead of your really good, no. But the emergency clinics are now seeing things that are not truly bona fide emergencies. And so that is causing, they may wait hours at the emergency clinic for care, or some of these emergency clinics are saying, no, you're going to have to wait the 3 weeks to get into your general veterinarian. You know, we are here for emergencies and the urgent care, and we can't be piled up, you know, with a 5-hour waiting period for people and burning out our staff and, you know, making them really upset. So that is one of the bad things, is that there's some decrease in efficiency. So what do we learn from all this, right? How can we take what we learned that was the not so good stuff, the bad stuff from curbside care, and still continue to improve when it comes to examining pets, providing less stressful veterinary care, you know, veterinary care experience, and continue to improve the ability for pets to get care, keeping care affordable, and including the client in it. So I did say that, you know, talked about, like, let's just find ways and just say to the client, I'm going to call you on FaceTime, okay? Just wait. And you bring their phone and it pops up on their screen like, oh, this is actually pretty easy, okay? Like, that's just what I would do. I would just use it on them and make them experience it and say, wasn't this better? I can actually see your pet walking around, and now in 30 seconds, I can give you advice instead of it taking 25 minutes, which is both what I need and you need, okay? Anyways, we just use it. We just say, all right, I'm going to and choose the easy platforms, the ones that do not require a lot of app downloading and so on. And then, you know, any other, in transparency. That as a practice, be transparent to your clients as to why you have to say no, okay? Second one, decreasing that separation anxiety of dogs to the owner. I have a video on my YouTube channel called Teaching Independence, and I call it the peekaboo game. And this is where I want every client, not just with puppies, but older dogs, and especially these rescues, because rescue dogs, separation anxiety is a leading behavior problem they all have. Anyway, that client is going to take a handful of food and be tossing it on the floor as the client walks away from the dog in the room. So the dog is learning to be by himself in the room while the owner goes down the hall to go to the bathroom or get a cup of coffee in the kitchen, that the dog is not constantly following them around. And when the owner is sitting there watching TV or reading the newspaper or checking stuff on their, you know, phone or laptop, they're tossing food to the dog to go away from them and to leave the room and stay away from them and not seek constant petting, not seek constant laying on their lap. So we build independence in the dog with these fun games, simple video on my YouTube channel. Send your clients to that so they start practicing that at home, and that's what's going to help whenever you need to leave that dog away from them. Last one, what lessons do we take from why we have less efficiency? Well, I guess my biggest one is going to be this. The clients, because they've been staying at home, are noticing kind of like every lump, every bump. Some of them that have not had the pet in for a year and a half are finally, maybe it's increased the value of the pet, that they are going to get their vaccinations. You know, they are going to put them on the heartworm preventative, you know, whatever. So for us to find ways to leverage and utilize our veterinary technician, another veterinarian somebody like me, who can provide a telehealth advice consult, or even in your own practice, say today's going to be our first checkup, if you will, is going to be done through a telehealth way that I can at least assess the home, assess the pet, assess their behavior, especially if they may need a pre-visit medication. In some of our states, they are now allowing for the prescribing of pre-visit medications, such that because it's increasing safety for the staff for coming in for that first exam. But this way we can address a lot of issues prior to, and so if it is going to be another 2 or 3 weeks before they can really get in for the appointment, the client has received some care, and you could get paid for this. Believe me, there are a lot of these teletriage and teleadvice platforms out there that clients are seeking just on Google. And so if it's one of your veterinarians who is maybe working part-time because they're a mother or a father and they want to stay home part-time with their kids, or again, the technician under the supervision of the veterinarian, just like our laws are for how we use a technician and leverage them in our practice, we can use them for tele checkups, checking up after the surgery. You don't have to come in the office for that. We could do it over the phone. We could do it on a video chat. Medication support, gait. What is their walking like? We can use it for a lot of things. But anyway, I think that is what's going to help us to improve our efficiency after this, while and leverage our staff without necessarily having to go back to, well, I need to have 20 staff members in the building and keep every single exam room filled and kind of run ourselves that way. Okay. Thank you very much. I hope everybody is doing well and staying safe, and those of you who are able to go on and get the vaccination, feel comfortable doing so. We've had vaccination here at this Bella Behavioral Learning Center is in a senior living community my husband and I own, and our staff and the residents who live here have all gone through their 2 vaccinations, the Madeira one without any problems. And in Illinois here, our rates are really decreasing so that we can have live events. Watch my website. I've just posted, I'm going to do a live stream of my puppy behavior consultant course with pandemic puppy problems as added content. It's going to be a live stream February 21st, but I am planning on doing an actual live event here in Tuscola by March 21st. And I can have at least up to 20 people for that. So I'm kind of excited to get back into real time presenting and things. Thank you so much. Please take care. I look forward to reading your comments, and I'll see you next week. Bye-bye.